Hey there, Justin Brock here with my buddy, my brother, Johnny Brock, and we are back again answering questions. We're the Medicare Brothers. We're answering questions that people are asking on Google about Medicare, and one of the most commonly asked questions is what medical expenses are not covered by Medicare? This is actually a really good question. Well, with Medicare, you have some crazy out-of-pocket that is even for services that they do cover. So you have some potential to be out of pocket 20% with no limit on Part B covered services. Part A, you also have some pretty high hospital copays you can encounter or skilled nursing facility copays. But since this is about the services that aren't covered particularly, I believe, we're going to go over those. And so first one is foreign travel emergency. So if you're traveling outside of the United States, and you have a medical emergency, Medicare itself will not pay. But if you have a Medicare supplement plan, it'll pay up to, depending on what the plan is, plans F, G, and N will pay up to $50,000 out of country, and they'll pay 80% up to $50,000 of those expenses. So a lot of people get stabilized and medevac back to the United States in that situation. We have had customers have that happen a couple of times. One in Mexico, had one even on an Alaskan cruise, but while they were on the cruise ship, they got medevaced to Canada because they were in international waters and closer to Canada, and had to use that Medicare supplement foreign travel emergency benefit. And with Medicare Advantage, we have discovered that some Medicare Advantage plans we've seen pay up to $250,000. Specifically, we ran into United Healthcare would help someone pay $250,000 on foreign travel. So that's one thing. Of course, three that often get brought up is dental, vision, and hearing. There's no standard coverage for dental, vision, and hearing in original or traditional Medicare, but you can get standalone plans, or Medicare Advantage plans could pay for dental, vision, and hearing. And then certain elective, experimental, or non-required vaccinations. So elective procedures would be like some sort of cosmetic augmentation, right, something like that. Experimental may be something that's not approved by Medicare to cover, but it may be something that your doctor recommends trying in a really crazy health scenario. And non-required vaccines, unfortunately, it takes a while for some of those to reach the covered phase. We even had a call this morning from someone who had a COVID, and this could be test too, COVID test for travel. So he didn't have any symptoms. It was an asymptomatic. It was a test related to travel. Medicare will not cover that right now. Also, Medicare would not cover certain types of like shingles vaccines, or they'll make you cover them under your Part D plan, not under your original Medicare. So that's it.
Yeah, unfortunately, they will not pay for your plastic surgery.
Yeah.
To look prettier is not going to be what Medicare wants to pay for.
Yeah, and most health insurance won't either. Now, if you have plastic surgery that's related to a required,
right,
something like you were a burn victim, or when you look at like breast augmentation for someone who is having back problems related to that would be something that can be medically necessary. But if it's just for someone's desire to look a different way, they're not going to cover that. So that's pretty much it. Those are the things that aren't covered. If you need help or have any specific questions, you can give us a call at 662-844-3300, or you can head over to BobbyBrockInsurance.com, where the Medicare Brothers and our entire team are helping people just like they were in our backyard, whether they're in New York, California, Pennsylvania, Mississippi, no matter where they're at, we're going to help them just like there's somebody right in our backyard. So give us a call or go visit us at BobbyBrockInsurance.com.